I'm Scott Kirby with Medicare Guidance Center. Thank you for tuning in. Today I want to talk about the differences between a Medicare Advantage and Medicare Supplement plan. One of the most common questions that we receive is, should I go with a Medicare Supplement plan or a Medicare Advantage plan to protect myself from out-of-pocket costs that original Medicare does not cover? The simple answer is yes. Every person is unique and different plan types work well for each individual person's needs. Let me illustrate it by giving you specific examples on some of the differences. Medicare Advantage plans are offered by private insurance companies that Medicare authorizes to administer and take care of your benefits. Because Medicare pays the insurance company directly, there is very little, if any, monthly premiums that you are typically responsible for. When this is done, your company of choice becomes your primary insurance. And what this really means is that the individual insurance company then outlines the specific copays that you're responsible for, the network of doctors they are contracted with, and the prescriptions that are on the formulary. This is why it is so important to identify any doctors and facilities that you want to continue to maintain and make sure they are contracted within the Medicare Advantage Plans network. Also, it is very important to make sure that your prescriptions will be covered. If you go to myplancomparison.com, you will be able to evaluate the Medicare Advantage benefits, identify if your doctors are in the network, and if your prescriptions are covered. I will give you an example on how Medicare Advantage HMO plans may work. Keep in mind that there are PPO Medicare Advantage plans that work differently. You are usually assigned to a primary care physician. When you go, there is usually very little, if any, out-of-pocket costs in the form of a copay. If you want to go to a specialist, you need to get a referral and pay the copay when you are seen. If you need to go to the emergency room, for example, you will also need to pay a copay for emergency room services, which usually includes the facility and doctor charges. If you need to be admitted to the hospital, you typically pay a specific copay for a certain number of days. Each Medicare Advantage plan has an annual maximum out-of-pocket. Now you may say, I don't want to be restricted to a network of physicians or facilities, and I want to manage my out-of-pocket costs more consistently. In that case, a Medicare supplement plan may be a better option. By paying a monthly premium and making original Medicare your primary insurance, you will be able to go to any doctor anywhere that is contracted with Medicare, both in and out of state. Additionally, you could get a supplemental plan that has a one-time annual deductible, and once that deductible is met, all Medicare-approved expenses for the rest of the year would be covered in full 100%. Also, it is important to note that a Medicare supplement plan doesn't include prescription drug coverage, so that would have to be purchased separately. Again, you can go to myplancomparison.com and compare Medicare supplement plan costs and prescription drug plans. We are always available to help in any way possible. Thank you so much for taking the time to listen.